This animation illustrates a procedure that aims to relieve the pressure on a spinal nerve as it leaves the foramen of the cervical vertebra. This is usually caused by a herniated disc putting pressure on the nerve, or the development of bone spurs causes narrowing of the foramen transmitting the nerve, which causes pain, weakness, or numbness. A small incision is made along the skin of the back of the neck. Once the muscles are moved aside and the surrounding tissues are parted, a small portion of the lamina and facet joint are removed using a burr and wronger. These procedures, known as laminectomies and fascectomies, aim to relieve pressure on the spinal cord and gain access to the intervertebral disc and the foramen transmitting the compressed nerve. Herniated material from the disc is removed if present, and if bone spurs have developed around the foramen, they may be removed with the burr if safe to do so, widening the space transmitting the nerve in a procedure called a foraminotomy.